I'm John DeShula. Welcome back to What's the Buzz in Western New York. November has been designated as Hospice and Palliative Care Awareness Month. That brings us to Sunset Drive in Lockport to Niagara Hospice. Let's come on inside. So now we're inside. I'm going to introduce you to Jane James. Jane, what is your title here at Niagara Hospice?
I'm the Director of Admissions with Niagara Hospice.
How does somebody gain admission to Niagara Hospice? What are some of the preconditions?
Sure, we take care of patients with end-stage illnesses, so that could be neurological disorders like ALS. We have quite a few of our patients have Alzheimer's and dementia. We have end-stage pulmonary diseases, COPD, cardiac disorders, end-stage congestive heart failure.
In addition to taking care of the patient, the family member is coming to you at a time where it's very difficult, very challenging, and you're able to help guide them through the administrative piece. What are some of the financial obligations or requirements?
Well, Medicare Part A covers hospice, the cost of hospice, so it is a benefit to the patient.
And you don't turn anybody away?
No, we don't.
Yeah. And in addition to being out in the community and having a long-term staff, you have the Niagara Hospice House that's here on the campus on Sunset Drive. Tell us about that.
That is a 20-bed unit right next door to this administration building. 10 of the beds are for our general inpatient use. These are patients that require symptom management, maybe IV medications, and they're there for short term, maybe 3 to 5 days, and then with the intention of returning home. And then we have the 10-bed residential unit where patients that require long-term care, they require 24-hour care, they come over there.
Yeah, it's a very welcoming place, and
It
would you
is.
take us over to see it?
Sure.
All right, let's take a look. Well, Jane, thanks for inviting us to Niagara Hospice House.
Yes, absolutely. Thanks for coming.
So show us a patient room, because this is where a patient would be admitted with their family members at a time that the need is most critical.
Sure, come take a look.
All right. Well, it's a beautifully appointed room,
Thank you.
very welcoming, and so for the patient, they're really going to have an opportunity to be in a place that's comforting and welcoming, and really for the family as well.
Yes, and we want the family to come here and be able to relax, spend time with their loved one while they're here, not really worry about the stress of caring for them.
And Jane, I understand that families can stay for as long or as little as they'd like to really get that final moment with their loved one, and you've made it very accommodating for them.
We have. We encourage the family to spend as much time as they would like with their loved one. We have pull-out couches available. We just purchased some new ones here, so they're very nice, very comfortable, and we do encourage them to stay as long as they like with the family member.
Jane, take us in now to one of the lounges that you have, because again, for the families that are here and patients, this is a place where they can come and enjoy a respite in a very welcoming environment.
Yes. We want the families, when they're here with their loved one, to be able to come, be comfortable like it's their own home, so they have access to a kitchen here.
And they bring their loved ones, and they bring children, grandchildren and children, and there's a place for the kids to play.
There is. There's a room for the kids to come if they need to get away from it all.
And with the kitchen behind us, we should mention that the food that's here at the Niagara Hospice House is prepared by a very special individual.
Yes, Chef Corey and his team are amazing. They do a fantastic job of preparing food for families that come here. We don't want the families to feel like they need to rush out and go grab a bite to eat somewhere, so they just prepare food for them while they're here.
Jane, thanks for inviting us to the Niagara Hospice campus.
Thank you.
You have a very dedicated team here at a time when it's very important for the families
We
and
do.
when they need that information and that service the most. And if you would like information, you can go to niagarahospice.org or give them a call at area code 716-439-4417. They're at 4675 Sunset Drive in Lockport, New York. Call 716-439-4417 and find out everything you need to know when you need it most. As our segment continues, in addition to being Hospice and Palliative Care Awareness Month, November is also Home Care Awareness Month. And that brings us to Liberty Home Care on Niagara Falls Boulevard. And I'm joined by Jennifer Redding. Jennifer, thanks for welcoming us.
Thank you.
What is your position here?
I'm the Vice President for Liberty Home Care.
Very important place with a very important mission. What is that mission?
Liberty Home Care's mission is to be our community's home health care provider of choice by offering the highest quality products and exceptional service and compassionate care for everybody who needs it.
Jennifer, how does somebody connect with Liberty Home Care? Is it an individual who's in a family and says, I think my loved one needs care? Does the individual who needs care reach out to you? How does that work?
Typically, the individual who needs the care is visited by a case manager. They're typically a member of a managed long-term care insurance plan, and they have a case manager who goes to the house and assesses them for a need for additional services. And they will then contact us to provide those services to the patient. An alternative way is to reach out to us directly and call and request services, and those individuals are typically private pay patients.
And you work in Niagara County, where you're based here, and also really pretty much all of Western New York.
Correct, yes.
And talk to me about Pathways, because that's the palliative care program where you work with the patient to help them through their medical condition.
Yeah, Pathways is a really fantastic program that we have. It's our palliative care program, as you mentioned, and it's a comprehensive service which has nurse, social worker, spiritual care, and there's physician backup, and they go into the home as well and connect individuals with chronic illness with community resources that they may need to help improve their quality of life. They help manage their symptoms as a result of the chronic illness that they have, to really keep them at home and comfortable and functioning and as symptom-free as possible. There's individual care plans for each person, especially on the home care side. Our nurses go out, they assess the patient, they establish a care plan that the aides then have to follow, and every time they go into the home, they have to follow their care plan and make sure that the patient's needs are met every single time they're there.
And if somebody wants information on Liberty Home Care, they can go on your website, libertyhomecare.org,
Yes.
and the phone number to call is 274-5000, that's area code 716.
Yes, and if they want Pathways, when they call that phone number, specifically state that you're calling regarding Pathways.
All right. Jennifer, thanks for joining us today.
Thank you.